What is recessive inheritance in genetic counseling? Imagine passing down a family trait that only shows up if both parents carry a special gene. That's what recessive inheritance is all about. It's a pattern of how genes are shared from parents to children. In this pattern, a person needs to inherit two copies of a mutated gene, one from each parent, to develop a specific condition. These genes are on chromosomes that are not related to sex, called autosomes. If someone inherits only one mutated gene and one normal gene, they are called a carrier. Carriers usually don't show symptoms but can pass the gene to their children. Understanding this pattern is very important in genetic counseling. It helps families know their chances of passing on genetic conditions. For cancer survivors, knowing about recessive inheritance can help with family planning and understanding hereditary cancer risks. Some genes tested in cancer panels can be involved in both dominant and recessive conditions. For example, a mutation in a gene might increase the risk of cancer if one copy is affected. But if both copies are inherited, it could cause other health issues. Certain genes linked to hereditary cancers also carry risks for recessive disorders. For example, Fanconi anemia and ataxia-telangiectasia are recessive conditions that happen if both parents pass on mutated copies of specific genes. Genetic counselors talk to patients about these risks, especially if they are thinking about having children. They discuss testing options, surveillance plans, and reproductive choices. For someone who has survived cancer, knowing about recessive inheritance can help them understand their own health risks. It can also show how they might pass on certain conditions to their children, even if they don't have symptoms themselves. Genetic counseling can guide survivors on how to monitor their health and that of their family members. It can suggest early detection strategies or preventive steps based on genetic findings. It's also important to keep updating family health history and genetic information over time. New testing methods and discoveries are always happening. This ongoing process helps ensure that survivors and their families have the most accurate information. Overall, understanding recessive inheritance in genetic counseling helps with making informed decisions about health, family planning, and follow-up care. It's a way to better understand inherited risks and plan for a healthier future.